Welcome everyone. My name is Jonalyn Vargas and I have been a certified phlebotomist at Grossmont Hospital for more than 9 years. And I'm also a member of our SEIU-UHW bargaining team fighting for our first contract at Sharp Healthcare. I am joined by bargaining team members from across Sharp Healthcare's facilities representing 5,000 frontline healthcare workers. My facility, Sharp Grossmont Hospital, Sharp HospiceCare, Chula Vista Medical Center, Sharp Memorial Hospital, Mesa Vista Hospital, and Mary Birch Hospital for Women and Newborns. We are here today because Sharp Healthcare executives are bargaining in bad faith and refusing to listen to frontline healthcare workers about the solutions we need to address the Sharp staffing crisis and skyrocketing cost of living in San Diego. Frontline healthcare workers are listening to patients, but Sharp executives are not, and the safety of workers and patients is on the line. The skyrocketing cost of living in San Diego, one of the most expensive regions in the country, is undercutting healthcare salaries. Many of our healthcare workers can't afford healthcare for their own families. This, coupled with the stress of understaffing, is causing healthcare workers to leave or consider leaving the field, which will worsen wait times and care delays. Sharp Healthcare can afford to do better. As San Diego County's largest private employer, Sharp has a reported net worth of nearly $5 billion and pays its top executives millions, more than $12.8 million in 2022. Sharp CEO Chris Howard's compensation has increased more than 43% since 2020. He is paid more than $2.4 million. That's more than $1,100 an hour, while frontline healthcare workers pay benefits and have stagnated amid rising inflation. As frontline healthcare workers, we've repeatedly raised our concerns with Sharp executives about how the staffing crisis is harming workers and patients. But instead of listening to us, they're breaking the law and bargaining in bad faith. What we are calling for is very simple. As frontline healthcare workers, we want Sharp executives to bargain in good faith and listen to us. Frontline healthcare workers want patients to be safe and get quality care and attention across all Sharp facilities. Frontline healthcare workers want Sharp executives to address the skyrocketing cost of living and end the Sharp staffing crisis. Today, as the combined bargaining teams from across Sharp Healthcare, we are calling on our 5,000 members to vote yes to authorize an unfair labor practice strike. We will be holding our ULP strike vote October 29th through November 1st. This doesn't automatically mean we will be going on strike. Sharp executives can prevent this work action by complying with the law and remedying the ULPs they've committed. But right now, they don't seem interested in doing that. As frontline healthcare workers, our first choice is to be at work, at the bedsides with patients, helping them heal and stay safe. That's why we work in healthcare, but the bad faith bargaining of our employer is leaving us little choice. Now I want to introduce a worker from Sharp Chula Vista Medical Center who will be sharing some of the concerns he's raised that Sharp executives are refusing to listen to. Please welcome Jesus Lopez.
Hello, everyone. My name is Jesus, and I'm a healthcare assistant at Sharp Chula Vista Medical Center. I work closely with patients recovering from strokes in our progressive care unit. The people I care for are going through a really difficult time in their lives. Often, they have lost the ability to do basic things we all take for granted, like walking to the bathroom, reaching for an object, or even the ability to speak. It takes a lot of compassion and understanding to care for people going through a medical event like that. But I love taking care of patients, and I love my job. Like all of us, my first choice is to be at work taking care of those in need. But I am voting to strike to put an end to unfair labor practices at Sharp Healthcare that are stalling the bargaining process and preventing us from improving working conditions and patient care. Healthcare workers like me listen directly to our patients and see care in crisis every single day. Because of the Sharp staffing crisis, I've seen my coworkers forced to care for as many as 30 patients at a time, and it's just not safe for us or for them. One time, I found a patient sitting in their own urine because there wasn't enough staff to care for them. It hurts to see a patient like that. It's humiliating for them, and it breaks my heart because all I want to do is be able to care for my patients safely and with dignity. The stresses of understaffing is causing healthcare workers to leave the field altogether, which will worsen wait times and care delays. I take that personally, and I think you should too. What if that was your loved one that was forced to wait too long for help getting to the bathroom, or even worse? We've organized our union to put an end to the sharp staffing crisis, but instead of working together with us to find solutions, they're breaking the law and bargaining in bad faith. Every SHARP facility needs the same high standard for staffing, patient care, and working conditions. By working together, we can solve the staffing problems to ensure better patient care at all SHARP hospitals. Frontline healthcare workers like me look into the eyes of our patients every day, and we know they need to be safe. It's time for SHARP executives to stop breaking the law and listen to the workers on the front lines. This is why I am voting to strike at SHARP Chula Vista. We've been pushed to the brink, and we demand an end to the unfair labor practices of our coworkers at SHARP Healthcare.
Thank you, Jesus. As SHARP Healthcare represents the largest private employer in San Diego County, they have a unique responsibility to ensure one standard of quality care and working conditions in our community. Now let's hear from another SHARP Healthcare worker, Ms. Corrine Ragsdale from Mary Birch Hospital.
Hello, everyone. My name is Corrine Ragsdale. I am a healthcare partner at SHARP Mary Birch Hospital for women and newborns. I have worked in healthcare since the birth of my second son 26 years ago, but I decided to become a caregiver much earlier than that. As a little girl, I wanted to be a teacher, but I used to help my grandmother with her insulin shots every day, and it changed who I wanted to become. She passed away when I was 13 years old. And that's when I decided I wanted to become a healthcare worker. I began my career working in orthopedic surgery and then as a certified nursing assistant. I started working at SHARP Grossmont Hospital 18 years ago. As a matter of fact, my daughter was born at Grossmont, and it had always been a special place to me. As a nursing assistant, I would take care of your loved ones on the floor by helping them with their medications, taking them to the bathroom, helping them walk, and even combing patients' hair. You'll be surprised how much that means to someone in the hospital. I didn't go into this line of work to make money. I do it because I believe in taking care of people. It's a calling. At Mary Birch Hospital, I take care of women and newborns, and it's easy to understand why I love what I do. Our hospital is a happy place where miracles happen every day. But underneath it all, I know things are not okay at SHARP Healthcare. I have seen the consequences of short staffing in our hospitals in my 18 years here, and it's getting worse as the cost of living skyrockets in San Diego. It's getting worse because frontline healthcare workers are not being heard at SHARP, and it's pushing us to the brink. I joined together with my coworkers to demand that we have a voice to improve patient care and working conditions in our hospitals. But management has responded by breaking the law and illegally stalling the bargaining process to delay the improvements that are desperately needed. While SHARP executives break the law and bargain in bad faith, I have been forced to relocate. My rent increased for the 4th time since the pandemic to more than $3,000 a month. My husband and I both work full-time jobs, but our income just wasn't enough. We would become homeless if we stayed in San Diego. So we moved to Tijuana to find housing we could afford. The rent is much better now, but now I have to commute about 4 hours every day on top of my 12-hour shift. I wake up at 2 a.m. to make it across the border by 5, and I try to take a nap in my car until my shift starts. I wouldn't clock out to go home until 7:30 that same day. I love my job, but I just don't know how much longer people like me will be able to hang on and what that will mean for our patients who rely on us. We need our employers to stop delaying the negotiations and bargaining in good faith to find solutions because people are suffering and we demand to be heard. This is why I'm voting to strike at Mary Birch. We've been pushed to the brink and we demand an end to the unfair labor practices against our coworkers at Sharp Healthcare.
Thank you, Corinne. Our fight for a fair contract at Sharp Healthcare has become the largest single employer labor dispute in California because too many patients are affected by delays in care and too many healthcare workers are leaving the field altogether because of poor working conditions and low pay. To put this historic fight into perspective, I would like to introduce the president of SEIU United Healthcare Workers, representing more than 110,000 union healthcare members, to speak about the fight for one standard of quality care and working conditions at Sharp.
All right, good morning, and thank you, Joni. My name is Dave Reagan. As Joni said, I'm the president of SEIU-UHW. We are a statewide healthcare workers union here in California with over 110,000 members. And what we want to share today with Sharp executives, the board of directors, leaders in the community, elected officials here in San Diego is, as you've heard from Jesus and Corinne and Joni, we are a union of caregivers. And too often that means that our employers use our instincts and our desire to be caregivers and to help other people and attempt to use that against us. As everyone here has said, we don't want to strike. We want to reach a fair contract. We want the law breaking and the illegal negotiating to stop. We want nothing more than in literally the next 2 weeks to come to an agreement for all 5,000 workers at Sharp who are part of our union. But if management continues to do what they are doing, even though we don't want to strike, we will strike. We are not afraid. We are frustrated. We are tired. We don't need people making $2.5 million a year, $1,100 an hour to tell people who are making $23, $25, $27 an hour that it's okay that you live in Tijuana and spend 4 hours a day commuting. That it's okay, even though you work for the richest healthcare provider in San Diego, that you can't afford to have your children on our health plan. There are people in this room standing with us here this morning who cannot afford to insure their own children, who cannot afford to make rent payments, and who are being told by someone making $2.5 million a year, who himself has received a 43% increase since 2020, that you should be just fine with the way we have decided to treat you. So, CEOs, board of directors, leaders here in San Diego, we want a contract. We're prepared to negotiate a contract, but don't make us do this. We are ready. We are not afraid. And if things don't change very quickly, we will be having the largest healthcare strike in the history of San Diego before the holidays start. That's what this is about. That's what this is about. That's who we are. We are caregivers. We live here. We work here. We want what's best for everyone. It's time that the management of this institution decided to listen to 5,000 people coming to work every single day who just want the best for themselves, their patients, and this community. Thank you very much.
So we can open up for questions you guys have, or anything for any of our speakers here.
Mind if we put your mic up?